What happens to your serum potassium level when your kidneys stop functioning properly? Your serum potassium level increases or decreases. What happens to your serum potassium level? Or do you know how much potassium is filtered by the human kidneys in a single day? So if you don't know, we are going to answer the questions in this video. Now this lecture is about the renal potassium excretion, an overview of the excretion of potassium by the kidneys. Now actually the excretion of potassium by the kidneys is the sum of the filtration. It is the sum of filtration. Potassium is being filtered here in the glomerulus, then it is the sum of filtration plus reabsorption, the amount of potassium that is reabsorbed from the nephrons into the interstitial fluid, and finally secretion of potassium by the tubules. Secretion of potassium by tubules. So excretion of potassium by the kidneys is the sum of these three factors. First of all, there is filtration of potassium into the nephron, then there is reabsorption, and finally there is secretion. But all these things vary depending upon the concentration of potassium in the plasma or upon different conditions. Now normally the kidneys filter around 180 liters of fluid per day, and the concentration of potassium in the blood is around 4.2 milliequivalent per liter. So the kidneys normally filter around 756 milliequivalent of potassium per day. 756 milliequivalent per day of potassium is filtered through the glomeruli into the nephrons. Now around 65% of this potassium, which is around 491 milliequivalent of this potassium, is reabsorbed by the proximal tubule, and around 204 milliequivalent, which is around 27%, or roughly 25 to 30%, is reabsorbed in the loop of Henle, especially the thick ascending limb of the loop of Henle. Now these factors mostly are fixed. The amount of potassium that is filtered, the amount of potassium that is reabsorbed in the proximal tubule, and the thick ascending limb of loop of Henle. The purpose of the kidneys is to help in maintenance of plasma potassium level. Now for this purpose, these values are mostly fixed, but the reabsorption or secretion of potassium in the distal tubule and collecting ducts is variable. Variable potassium secretion in the distal tubules mediates most daily changes in potassium excretion. So it is all dependent upon the distal tubules, which will determine how much potassium is going to be excreted, not upon the proximal tubule or the thick ascending limb of the loop of Henle. Now we discussed that around 65% is reabsorbed here, 402% or 25 to 30% is reabsorbed here. The remaining 8% reaches the distal tubules. Now the principal cells in the late distal tubule and the cortical collecting tubule are the most important cells, and they normally help in reabsorption or secretion. Here the potassium can either be reabsorbed from the tubule into the interstitium, or the potassium can be excreted from the interstitium into the tubule, and this is dependent upon the intake of potassium. If the intake of potassium is high, the excretion is high. Now normally what happens is, normally we consume around 100 milliequivalent of potassium. Out of this, around 92 milliequivalent is excreted in the kidneys, and around 8% is excreted in the feces. Out of this 92 milliequivalent that is excreted by the kidneys, around 60 milliequivalent comes through the distal tubule, and especially the principal cells in the late distal tubule and cortical collecting tubules. Now if you sum up all these 491, 204, 30 and 60, you will come to know that the amount is even more than that was filtered here. 756 was filtered here, but if you sum it up all, it will be more than 756. It's because of this distal tubule, which is the master player in determining whether the potassium is going to be excreted or reabsorbed. So normally, in normal circumstances, when potassium intake is around 100 milliequivalent per day, it manipulates the reabsorption and secretion process in such a way that out of 100, around 92 milliequivalent is excreted per day. And if there is decrease intake of potassium, then the secretion from these cells, the principal cells, these are the principal cells in the distal tubule, then they stop secreting potassium, rather they start reabsorbing potassium. So the renal potassium excretion is mostly dependent upon filtration, reabsorption and secretion. On top of that, the daily manipulation, the daily changes that occur in the excretion, whether a lot of potassium is to be excreted or less, or potassium has to be excreted, it depends upon the intake of daily potassium level, and that daily intake is mostly adjusted by the principal cells present in the distal tubule, So that's an overview of the renal potassium excretion. Now we asked a question that what will happen to renal potassium if the kidneys stop functioning properly. So we know that there is filtration, then reabsorption and continuous excretion of, out of 100 milliequivalent, around 92 milliequivalent are daily excreted by the kidneys. Out of 100, around 92 are daily excreted by the kidneys. So if the kidneys stop functioning properly, then the serum potassium keeps on increasing and acidosis occurs, and sometimes with increasing potassium level it is necessary to do dialysis. So that's a simple overview of the renal potassium excretion. In the coming lectures we will discuss these things in more detail. Thanks a lot for watching the video.